Hi, my name is Dr. Joseph Yazdi. I'm a board-certified neurosurgeon with over 20 years of experience. My goal with this video is to provide a complete reference guide for you about your surgical procedure. I will explain to you why and how your surgery is performed, review the risks and benefits of the surgery, and other treatment options to consider. We will also discuss your post-operative care. I hope that this video will be a recreation of your office visit and a good reference guide for you, your family, and your friends. The typical reason to come and see me is for back pain with radiation of pain, numbness, or weakness into one or both legs. Symptoms are usually worse the longer you're up and walking or if you're trying to bend and lift. By the time we're talking about surgery, it means that you've already tried physical therapy or chiropractic treatments, maybe even some injections, and they didn't really work. So now you're here to look at the next option, which is surgery. The most critical part of surgery decision making is to see if your symptoms match the MRI findings. If they do, then surgery should be a very good option for you. You will have the highest chance of successful surgery, one in which you will resolve all your symptoms and get back to normal full work function. So why do we do lumbar laminectomy? The purpose is to relieve stenosis, which is basically narrowing within the central canal. We're looking at a normal spine level here, where you can see all the little nerves. Those are the little dots in the middle there. And you can see the cross-section area that's there for these nerves to be able to function properly. This, on the other hand, is a stenotic level where you can see all the nerves are a lot more compact together. The reason is because there's a lot of arthritic changes from the lamina and the ligaments that are right behind them, pushing into the central canal, causing pressure on the nerves. The goal of surgery is to recreate that normal central canal. We do that by removing these posterior elements called the lamina and the ligaments that are causing the pressure on the nerves. When we remove them, the nerves will go back into their normal position and hopefully back to their normal function. So this is a representative spine model. These are the spinous process. These are the parts of the bone that we can feel when we touch our back. These are the lamina, and in front of the lamina is the spinal canal, and this is where the nerves are. And if the lamina get thick and the ligaments that are behind them get also thick, then there's going to be a lot of pressure on the nerves. So the goal of surgery is to basically remove what you see between my thumbs, the spinous process and the lamina and the underlying ligaments. And that way we decompress the spinal canal. So what are the risks of surgery? There is risk of bleeding and infection, just like any other surgery. The other risks are all related to working on and around the nerves. Those include weakness or paralysis, numbness, loss of bowel and bladder function, and that surgery may not resolve all your symptoms. The chances are low, but never zero. You will typically be discharged home within a few hours from surgery. As for post-operative instructions, I would like to keep the dressing on and dry for the next 2 days. Then you can remove it and take a full body shower. But I would like you to avoid taking a bath or soaking it in a pool. I want you to keep lifting less than 10 pounds. You may walk or go up and down the stairs as long as you're comfortable. I will see you back in the office at 2, 6, and 12 weeks from surgery. And we will get x-rays periodically to make sure that everything is not only in good position, but that the healing is coming along as expected. You may get some physical therapy or chiropractic treatments after surgery. It will depend on a number of factors that we will discuss. Most patients typically go back to light duty work at 6 weeks and heavier work at about 3 months.